Problems can occur frequently with an access device. These problems are often serious medical events and need to be immediately identified and addressed. Problems most often associated with access devices are occlusion, emboli, extravasation or infiltration, phlebitis, and infection.
Oh, hi, Steve. Steve, I cannot get a blood return from this.
Okay, Joanne. Well, let's take a look here. This is a triple lumen power pick, and it has clamps, so we know it's an open-ended catheter. Do you know if this catheter has been flushed with heparin?
It's the first time
No?
I've used it this shift.
Well, let me try. Remember to open the clamps. And no, I can't get a blood return either, so I think we need to change the needleless connector first.
I have one.
You should change the needleless connector every 72 hours, routinely.
Okay.
If you're doing transfusions or frequent blood draws, you might want to change it more frequently, but preferably not more than once every 24 hours.
Okay.
We want to keep a closed system as much as possible.
Okay, Steve. Do you want me to go ahead and check it?
Sure.
No, I'm still
Still
getting
doesn't
nothing.
work. Well, I think that what we need to do is to put some TPA in the line and clear that occlusion. So why don't you call me when it's on the floor?
Okay, I will. Steve, is there any place I should document this cap change?
Oh yeah, you should document it in the care decks
In the care
each time you
decks.
change the cap.
Okay, I'll do that. I can't get this pick to flush or get a blood return. Should I have used heparin?
Well, let's check out this catheter. There are no clamps, and it has a valve, which means it's a solo power pick. So if you can't flush it, probably the first thing we need to do is to change the needleless connector.
Actually, I already did that. This patient told me sometimes if I flush real firm, it can work. Do you want me to give that a try?
No, you shouldn't do that. Using excessive force can cause this catheter to aneurysm or to rupture. You should only flush if it flushes with ease. Otherwise, it means we need to clear the catheter with some TPA.
An embolus is a mass or foreign object that travels through the bloodstream and may cause serious patient injury or death. Emboli can be comprised of air, catheter or wire, or thrombotic material. Air may enter an IV line during administration of drugs or flushing when a line is left unclamped or when there is no needleless connector or an end cap attached to the catheter or stock cocks. Although many occurrences of air embolism go unreported because they are not symptomatic, entrapment of large quantities of air can lead to severe neurologic injury, cardiovascular collapse, and even death. Catheter emboli can occur during insertion of peripheral or central lines or during forceful flushing or removal of central lines. Wire emboli occur during catheter insertion. Foreign objects left in patients and air embolism are considered never events by the Center for Medicare, Medicaid Services, or CMS. Because these events are preventable, they are not reimbursable. They are reportable events. Thrombosis occurs for many reasons, including increased blood viscosity, reduced blood flow through the vessel, trauma to the blood vessel, patient pathology, and improper care of catheters and their add-on devices. Failure to clamp non-valved catheters causes reflux back into the catheter. A clinician flushing a non-clamped line may be flushing clot material into the patient's bloodstream. Clinical emboli are considered a medical emergency. Symptoms of pulmonary embolism may be vague, or they may resemble symptoms associated with other diseases. Symptoms can include deep respirations and/or shortness of breath, cough with or without hemoptysis, cyanosis, chest pain, gasping or tachypnea, tachycardia, low or absent blood pressure. If you suspect catheter embolism from a peripheral site, keep the patient quiet. Immediately tourniquet the limb proximal to the suspected embolus. Initiate the critical access team or CAT. Although many occurrences of air embolism go unreported because they are not symptomatic, entrapment of large quantities of air can lead to severe neurologic injury, cardiovascular collapse, and death. Clamp or kink catheter immediately. Position patient on their left side with head down. Initiate the CAT and continue with life-saving measures. For severe, life-threatening thromboembolism, treatment may consist of dissolving the clot with thrombolytic therapy. Anticoagulant therapy prevents the formation of more clots and allows the body to reabsorb the existing clots faster. TPA, a clot-dissolving medication, is most commonly used. Extravasation occur when a damaging infusion compound infiltrates from a vascular access site into the patient's surrounding tissue. These same compounds can cause phlebitis. Infiltrations and extravasation occur with any type of vascular access device, including central venous access devices. Nurses and other clinicians using vascular access devices must assess for infiltration prior to every use. Vascular access sites with infusions running should be assessed at minimally hourly. Begin to understand extravasation by knowing what medications and infusions can cause it. Here are a few common ones. Pharmacy has the most common and complete list of extravasants and their antidotes. Whether or not you are sure that it is an infiltration or an extravasation, follow these steps. Discontinue infusion immediately and disconnect the line. Leave the catheter in place until treatment is determined. Clamp, if applicable. Initiate pharmacy consult and notify physician. Do not flush. Continue to follow the policy, extravasation. There are no black and white rules about applying heat or cold as antidotes. It is solution specific. The pharmacy will have this information. The infiltration scale can be found in the extravasation policy and will also be incorporated into PRISM. If you determine an infiltration is mild to moderate, grade 0 through 1, it should not be necessary to notify the MD unless you have other cause for concern. Phlebitis is irritation and inflammation of the inner layers of the vein caused by mechanical trauma from needle puncture and catheter movement, chemical trauma by infusion of irritant or vesicant, and or by bacterial contamination leading to septic phlebitis. Phlebitis can cause significant discomfort and negative outcomes such as bacteremia, loss of vein, and loss of limb function. The phlebitis scale can be found on the back of the IV therapy flow sheet and will be incorporated into PRISM.